Medical Tactile Incorporated presents a clinical training video for the SureTouch system narrated by Dr. Carrie Kaufman. The use of these videos is strictly for demonstration of and the clinical training on the SureTouch visual mapping system by Medical Tactile Incorporated. The use or reproduction of these videos for any other purpose is expressly prohibited without the approval of Medical Tactile.
Patient number 7 is a female patient with a palpable mass in her right breast in the approximate location of the number 1 marker. So this patient is undergoing a focused examination of the right breast. And this case is an excellent depiction of what a large multi-peak mass looks like. So let's hear Dr. Kaufman's thoughts on this SureTouch examination.
The mass on the breast map was seen at about 12 o'clock here, located in number 1. And there are 2 images. And we're going to look at 1.1 first, which is over here in the mesh. I find it most helpful to have this as a mesh display, and the accumulated image obviously as a 2-dimensional. But the mesh display for me is a little bit easier than the 2D exam. So I usually watch this as a mesh display. So here is 1.1, and let's look at it first. As we look at it, we see rapidly the transducer is just sitting right on top of the mass. And keeping the mass in the center of the transducer, we see that this is quite a large mass filling the entire transducer. And it essentially, I'm just going to keep playing it for a second, it almost fills the entire transducer. Certainly the width of the transducer is filled with mass almost from one end to the other. The second thing we note, other than size, is how multilobulated it is, or how many multiple peaks there are. There's a high spot here, but a significant shoulder over there. And as we lay the transducer over the mass, we see this is a multilobulated, multiple peak lesion. The other thing that is useful for us to realize that if the mass is much bigger than this, then it's going to encompass the entire transducer, and there won't be, like down here in the dark blue, that's the only normal breast tissue we can compare it to. But at least there is dark blue, these 3 points, these 3 corners, 1, 2, 3, watch it again, these 3 points, 1, 2, 3, and 4, are staying down at the baseline level. That one went up a little bit there. And that's the only way that the SureTouch can tell how tall this peak is, because there's some normal pressure here. If the mass was as big as the whole transducer, then we wouldn't have any 0 point, and the whole level of the mesh would rise, and we wouldn't have a 5. We might have 0 hardness if the entire mass filled the entire transducer. But in this case it doesn't, and we see a big peak here with multiple shoulders. And as we move it around, we see several multiple peaks. And this certainly is a very suspicious mass. It's on the right breast at 12 o'clock, measuring 2.5 centimeters by 1.5 centimeters, and quite hard and multiple peaks. If we look at the second exam, we see a similar finding. It doesn't really tell us anything new, and that's what we want. I like to examine a mass at least twice, just to be sure there aren't any surprises and we're not missing something. You'll see the shoulders, you'll see the shape of the peak of the mass. Again, like I say, the shoulders, multiple lobulations, overall size. Again, keeping the points, the corners of the transducer in a relatively normal area. And this gives us evaluation. As is always useful, it's good to look at your size calculation to be sure your size is accurate. If this happens to be at a different number than 40%, we might artifactually get a smaller size or an artifactually larger size than is true. And it is of note that I used 1.8 kilograms of pressure. This is a fairly significant amount of pressure, and this is a fairly hard mass. And patients if they have a tender mass, they won't let you press 1.8, and that's an indirect kind of subtle sign that if you can press this hard and get this kind of peak pressure and it's not tender to the patient, that is very suspicious for it being a breast cancer. It's useful to look at the system. Again, 40%. Our map scales up to 20 kilopascals, which is a good diagnostic mode. And this is an excellent exam of a malignant mass.
Medical Tactile would like to extend our sincere appreciation to Dr. Carrie Kaufman, the medical director at Bellingham Breast Center in Bellingham, Washington, for his time and participation in this video. You can find out more information about the SureTouch visual mapping system and Medical Tactile Incorporated at our website at www.medicaltactile.com. Thank you.